The most common direct cause of postpartum hemorrhage is. Correct answer is option A, uterine atony. The most common cause of maternal mortality in developing countries is. Correct answer is option A, obstetric hemorrhage. The commonest cause of viscovaginal fistula in developing countries is. Correct answer is option D, obstructed labor. The most common indication for cesarean section worldwide is. Correct answer is option C, previous cesarean section. The hormone responsible for maintaining the corpus luteum in early pregnancy is. Correct answer is option B, HCG. The most common cause of postmenopausal bleeding is. Correct answer is option A, endometrial atrophy. The most common gynecological malignancy is. Correct answer is option C, endometrial cancer. The gold standard treatment for severe cervical dysplasia is. Correct answer is option B, lip arconization. The classic trait of ectopic pregnancy includes amenorrhea, abdominal pain, and. Correct answer is option C, vaginal bleeding. The most common cause of oligohydramnios is. Correct answer is option A, renal agenesis. The most accurate method of pregnancy dating in the first trimester is. Correct answer is option C, ultrasound ground rump length. The best method for assessing fetal growth restriction is. Correct answer is option B, ultrasound biometric. Which maneuver delivers the aftercoming head of breech? Correct answer is option C, mcqs maneuver. The most common cause of primary postpartum hemorrhage is. Correct answer is option D, uterine atony. A fetus with hydrocephalus commonly present with. Correct answer is option B, pro presentation. Which condition is characterized by wine-colored amniotic fluid? Correct answer is option C, abruption placenta. The most common cause of postpartum pituitary necrosis is. Correct answer is option B, severe postpartum hemorrhage. The most common cause of maternal death in eclampsia is. Correct answer is option C, cerebral hemorrhage. Which fetal skull diameter present in bro presentation? Correct answer is option D, verticobuntal. The most common cause of disseminated intravascular coagulation in obstetrics is. Correct answer is option B, placental abruption. A woman at 32 weeks gestation present with hypertension, hemolysis, elevated liver enzymes, and thrombocytopenia. The diagnosis is. Correct answer is option B. The definitive treatment for invasive cervical cancer may include. Correct answer is option B, radiation and surgery. A pregnant woman with BP 160 over 110 mm of mercury, proteinuria and seizures is diagnosed with. Correct answer is option C, eclampsia. The most common symptom of cervical cancer is. Correct answer is option A, postcoital bleeding. Which condition requires methotrexate therapy? Correct answer is option B, ectopic pregnancy. The safest position for a pregnant woman after 20 weeks is. Correct answer is option C, left lateral. The engagement of the fetal head means. Correct answer is option B, bibrachial diameter has past pelvic inlet. The most common cause of neonatal death is. Correct answer is option C, prematurity complication. The drug used to treat postpartum endometriosis is. Correct answer is option A, broad spectrum antibiotics. The most common cause of infertility in women is. Correct answer is option B, cervical cancer. Which vitamin deficiency causes the risk of neural tube defects? Correct answer is option C, folic acid. Which STI is strongly associated with cervical cancer? Correct answer is option C, HPV. The most common cause of maternal mortality worldwide is. Correct answer is option C, hemorrhage. A positive Chadwick sign refers to. Correct answer is option A, bluish discoloration of cervix and vagina. Which condition is associated with a broad-like abdomen? Correct answer is option C, abruption placenta. The most common site of ectopic pregnancy is. Correct answer is option C, fallopian tube. The antidote for magnesium sulfate toxicity is. Correct answer is option B, calcium gluconate. Quickening is usually felt by a preemie gravidia at. Correct answer is option C, 20 weeks. Which pelvic type is most favorable for vaginal delivery? Correct answer is option C, gynecoid. The first maneuver of Leopold determines. Correct answer is option C, fundal content. Magnesium sulfate is mainly used in. Correct answer is option B, preeclampsia or eclampsia. The drug of choice for preventing postpartum hemorrhage is. Correct answer is option B, oxytocin. Painless vaginal bleeding during late pregnancy is characteristic of. Correct answer is option B, placenta previa. The presenting diameter in a well-flexed vertex presentation is. Correct answer is option C, suboccipitophragmatic. The cardinal sign of placental separation is. Correct answer is option C, sudden gush of blood. Which hormone is primarily responsible for maintaining pregnancy in the first trimester? Correct answer is option C, progesterone. The normal fetal heart rate ranged between. Correct answer is option B, 110 to 160 bpm. The most common cause of postpartum hemorrhage is. Correct answer is option C, uterine atony. The normal duration of a menstrual cycle is. Correct answer is option B, 21 to 35 days. The most lethal gynecological cancer is. Correct answer is option B, ovarian cancer.